Hi, I'm Kaylee. I'm one of the physical therapists at Deaconess, and I'm here to talk a little bit about what to expect following your total knee replacement from a physical therapy standpoint. First of all, I have a little model of the knee, and we'll just discuss this so you can see the anatomy of your knee joint. Here's your femur sitting on top of your tibia. You have your quadriceps muscle that runs over the knee, and then behind that you can see your kneecap or your patella. So this gives you a little insight into the joint prior to surgery. What you're going to be expecting during surgery is having an incision across the front of the knee. They'll move the quadriceps muscle and the kneecap out of the way to access the joint. You can see the ligaments here in the knee. The ligament that you'll have removed will be the anterior cruciate ligament. And then we'll replace that with a component with a stop there. Otherwise, your other ligaments are going to be spared, so they're not going to be affected by the surgery. Once they've removed the portions of the bone that they're going to be replacing with the components, they'll make sure that everything fits securely, that everything's moving smoothly before they close the knee joint. Here's what is going to end up inside the joint following surgery. So you have a femoral component and a tibial component, and they're going to rest on top of each other. The metal is usually a titanium alloy, so that's pretty light but very strong. The plastic part is a polyethylene, and that's going to just allow for smooth movement between the metal component and then the plastic. So you can see that the knee joint will move through motion just like it would have with your natural joint. Usually before you leave surgery, the surgeon's going to make sure that your knee can go from all the way straight, or what we call 0 degrees extension, and then also bend up to 120 degrees of flexion. So they're going to make sure that you have adequate motion in that joint before you leave the operating room. Usually patients stay 2 to 3 days following surgery, and that doesn't include the day of surgery. If your goal is to return home after your surgery, then that's certainly our goal too, and we'll work with you towards that as far as with therapy. Sometimes patients do require more rehab, and will go to another facility following their hospital stay to do that prior to going home. But we usually try to work with you on your goals for returning home prior to that. If you have your surgery in the morning, then we'll attempt to see you in the afternoon following the surgery if that's what the surgeon requests. If your surgery is in the afternoon, then we'll see you the following morning in order to initiate your mobility. At that time, we'll have more information on your weight-bearing status from the surgeon. Usually it's weight-bearing as tolerated, but every once in a while, depending on specifics of the surgery, a surgeon will specifically say, they want less than weight-bearing as tolerated. So we'll let you know about that. Every once in a while, surgeons will want us to use a continuous passive motion device, or CPM we call it. They usually let the therapist decide whether or not it's necessary, but sometimes they'll specifically request it for a patient. The CPM is basically a device that fits underneath your leg, and it's going to passively move your leg and your knee into flexion and then back down into extension, so just bending and straightening your knee. And that just helps to initiate movement and start range of motion early. So we'll make sure that we assess your needs for that while you're in the hospital right away. If a CPM is requested for home, then we have you use it in the hospital, so that insurance will cover the cost of the rental. One of the most important things after surgery is making sure that your pain is tolerable, and nursing will assist you with this as well, but we want to make sure that you're staying up on taking your pain medications in order to be able to tolerate movement and tolerate your therapy. We expect you to have pain after surgery, so that's why your pain medications are available, and certainly use them as you need in order to be able to participate in walking and movement and moving towards your goals of going home. There are exercises in your book that are listed, and we recommend that you look through them and practice them a few times prior to coming into the hospital. That way when we come to see you, you'll be familiar with them, and you should have a little head start as far as getting going with your strengthening after surgery. The first time we come to see you, you're going to have a lot of equipment attached to you. You'll probably still have an IV, you'll probably have a catheter, possibly a drain. So all of those things are items that we can take with us when we get moving initially, and they don't prevent you from getting up or walking or anything like that. Usually we'll start you having a front-wheeled walker to begin with. This gives you a little bit of extra balance, stability, and assists with weight bearing to start. The first time you get up, you may feel dizzy, you may feel lightheaded. Those are all normal responses, and we always cater your sessions to how you're feeling, and we'll progress you as you're able to tolerate. So we expect you to have some difficulty starting out. The first session, we're going to look at your range of motion, so making sure that we can check how much your knee is able to bend and how much you're able to straighten it. We'll review your precautions and educate you on your weight-bearing status. We're going to start your mobility tasks, so we'll start helping you to get out of bed and transfer into chair, sit up for a while, begin walking. We'll discuss your home situation so we can start to prepare for your discharge and know what types of activities you're going to need to be able to do for that. We're going to assess your need for the CPM, or the continuous passive motion device, if you need assistance as far as moving through your range of motion. And then we'll initiate your exercise program. So probably similar to what's in the booklet that you have, we'll begin those exercises. You'll be seen twice a day for the entire time that you're in the hospital. So we'll see you morning and afternoon. Each session we're going to try to progress your mobility tasks. Have you walk a little bit further, tolerate sitting up a little bit longer, those types of things. Start stair training as you need it, so that we can try to get you to the point where you're comfortable getting around home. We're going to start to continue and progress your exercise program. So as you can tolerate more exercises and as you're able to do more on your own, we're going to progress that. We'll continue to watch your range of motion, so watching if you're able to bend your knee further and progress that. We're going to assess your equipment needs, so if you need a front-wheeled walker or if there's any other equipment that you need prior to going home, we're going to make sure that you have that available, order it for you if needed. We'll discuss car transfer, so you're comfortable getting in and out of a car for heading home or going to appointments. And any other concerns that you or your family have, we'll address during our therapy sessions. If you're planning on doing any lengthy travel, going on any trips, you'll need to discuss that with your surgeon. Also, returning to work is another topic to discuss with the surgeon, as well as returning to driving. They will be the ones to clear you for that. Like I said, we start with a front-wheeled walker to begin with, and then if you're doing great, we can progress you to using something else. Usually, though, patients are using a front-wheeled walker when they leave the hospital after the surgery, and we want to make sure that you're able to demonstrate correct gait technique and demonstrate a normal gait pattern prior to taking the walker away or progressing to a cane, because we want to establish good habits from the start. So expect to be using a front-wheeled walker and then probably using one when you head home as well.